My name is Darren Roa. I'm a surgeon at Veterinary Specialist Services in Carrara, and I'm going to talk to you a little bit about cranial cruciate ligament disease in the dog. The cruciate ligament is the most commonly injured portion of the dog's knee that requires surgery in veterinary medicine. The cruciate ligament is one of the primary stabilizers of the knee, and you may have heard of it termed an anterior cruciate ligament in people, or ACL, very common sports injury. Well, dogs injure their cruciates all the time, unfortunately, and many of them require surgery. So when your dog has an injured knee, you may have gone in to see your vet and they've referred you to a specialist, or you've come in to us primarily for a lameness problem. A diagnosis of a cranial cruciate ligament is made. There are a couple of things that we do to make this diagnosis. Most importantly is a physical examination in which we evaluate the stability of the knee. And in most cases we can make the diagnosis with that. However, X-rays, sometimes MRI or CT scan advanced imaging techniques are used to support that diagnosis. Once the diagnosis is made, your surgeon will sit and talk to you about possible treatment options. And there are several broad categories of treatment for surgery in the dog. The two main categories would be extracapsular stabilization techniques and osteotomy techniques. Extracapsular stabilization techniques have been around for 50-odd years, and there are a variety of them, and all of them can be successful depending on surgeon experience. The overall outcome from these surgeries is usually good. However, a complete return to athletic function is usually not able to be done with this type of surgery. However, good comfort and good quality of life can be maintained. Also, typically smaller dogs will do better with this surgery than larger dogs. For the more advanced surgical stabilization, these are generally what are termed osteotomy techniques, and osteotomy means cutting of bone. So they involve making bone cuts in the tibia, which is the lower bone in the stifle joint, and then changing the position of these bones to remove the instability that happens when the cruciate ligament is torn. These new bone positions then have to be stabilized with bone plating and screws until the bone heals. Once the bone heals, the hardware is no longer necessary. It's designed to stay in there, so typically it's not removed. But it's the altered position of the bone that gives the dog a stable knee. The principal benefit of this surgery is that it will allow dogs to typically return to athletic function and have minimal progression of arthritis compared to other techniques. Additionally, when making the diagnosis and/or doing the surgery, many of these dogs will have their knees arthroscopically examined. An arthroscope is a surgical telescope that's inserted in the knee and allows us to inspect the joint under magnification. This allows us to confirm the diagnosis, perform necessary debridement of the torn cruciate ligament, and evaluate the cartilage in the knee. It's not uncommon that many dogs will have a torn meniscus at the time of cruciate surgery, and those can be addressed at the same time. So when making a decision between the extracapsular techniques and the osteotomy techniques, the surgeon will discuss with the owner what's going to be the best fit for the patient. And again, typically smaller dogs are going to do good with the extracapsular techniques and very good with the osteotomy techniques. Larger dogs will do fair with the extracapsular techniques and very good with the osteotomy techniques. So generally speaking, we're going to strongly recommend an osteotomy technique for a larger dog. And if you have a smaller dog that is a high performance or athletic dog, that too is going to be much more suited to an osteotomy technique. I would in general, outside of cost considerations, base the recommendation for the extracapsular techniques to smaller dogs that have a fairly sedentary lifestyle. All right, once the decision has been made for your dog to go to surgery, then a surgical appointment will be scheduled. Your dog is typically either going to stay in the night before surgery if it's to be performed the day after the consult, or if it's a different day scheduled, your dog would be dropped off the morning of surgery. At that time, we will analyze preoperative blood work to make sure that there are no concerning problems associated with general anesthesia. And then the dog is anesthetized. This is done under the supervision of our specialist anesthetists. at which point any preoperative x-rays and planning x-rays are taken, and then your dog is taken to surgery for whichever technique we've decided to perform. While under anesthesia, it's important that your dog is carefully monitored to make sure no complications arise from general anesthesia. We utilize a lot of technology, including ECG, pulse oximetry, capnography, and any other blood pressure monitoring techniques to ensure that your dog has the safest anesthetic experience possible. Additionally, specialized pain control methods, including epidural and nerve blocks, are done to be sure that the procedure is done as painlessly as possible. They're then recovered in our intensive care unit under the supervision of our nurses, with special attention paid to ensuring that post-operative pain is managed and that your dogs are up and moving and eating and drinking as soon as possible. Most patients are discharged the day after surgery. At that time, the surgeon will go over the discharge instructions with you, which will also be written out, and you'll be handed any medications, including pain medications and antibiotics, that may be necessary to ensure your patient's recovery post-operatively. At 2 weeks, they're brought in to ensure the incision is completely healed, and during that first 2-week period, dogs will be instructed to wear an Elizabethan collar so that they don't molest the incision. This is the most frequent cause of post-operative complications, including opening up of the incision or infection. So by ensuring you adhere to these restrictions, you can avoid a lot of complication. For the first 6 weeks, most dogs are strictly confined to small rooms with good footing or crates to ensure that they don't damage the repairs. So really the first period of time is centered upon preventing the animal from damaging the repair. At that 6-week recheck, the dog will be examined and or radiographed to ensure that healing is proceeding as we expect. And you'll be given further instructions with regard to increasing activity level and physiotherapy. Typically that will result in increasing length lead walks, swim therapy, and other manipulative procedures to help your dog get back muscle mass, range of motion to the joint, and pain-free mobility. Most dogs with cruciate ligament surgery are soundly weight-bearing and relatively pain-free by 3 months. However, it may be as long as 6 months before they achieve maximal results. And in this case, many dogs are able to return to normal athletic function and agility training.